So shall we start the class?
Okay, doctor.
Okay.
Yes. So actually yesterday's question, I have not answered. I was a bit busy in the morning. So I will just tell you now. Yesterday's question was, what was the question yesterday? That is, what is the difference? When do you give K3 and when do you give SP9? Right?
Yes.
That was the question. See, it is two things you should remember. Suppose let us just presume a tank full of water, right? Tank full of. So when does the water get out of the tank? One is when the water is more. Okay, when the water is more, then it will get out. Or when when the earth is weak, even then it can get out.
Okay.
The situation in a toothache, it is what situation in a toothache, the gums are weak. Okay, the water is okay, the gums are weak. So the water energy is there. So what do? You have to strengthen the gums. You have to strengthen the earth. So from water, you give you give earth. That is K3. Whereas SP9, when do you give? The water, suppose somebody has got a problem, gynec problem or whatever it is. At the time, water is more. Earth is okay. So in earth channel, you give water. This is what you have to really look into. Slightly going deeper, selecting the correct point. Selecting the correct point. The same thing can happen during any disease if you take. So one will be good, one will be stable, another one will be weak. Find out which is weak. Find out which is weak. On the other day, I had another case. See, that lady was having some large intestine problem. Okay. Interaction was between large intestine and fire. That is, the large intestine has to take away the water, right? And that will be given to the small intestine because it hardens the stools. So it has to be given to the small intestine. So the large intestine was in trouble. Well, her motion was not all right. That this and that. So water was not going. So her water was going. Fire built up. Okay. So the thing which is good was large intestine. Okay, but good was small intestine. Thing which was not already imbalanced is large intestine. So you have to give in small intestine. Yeah.
Okay.
So SA1. So I asked her to put the pepper in SA1 and I. You will be really surprised. Within 1 day she became on. So that is because you are hit on the spot. Hit on the spot. Especially when you are not clear what you have to do, you can give the in channel. But if you know that for sure that the in channel is affected, give it an in channel. It will definitely. That is what the whole thing I wanted to say. Another question was about bold. So when do you become bold? What is the opposite of bold? In this class we will teach you. Opposite of bold is fear. Opposite of bold is fear. So the water element, it will. If the person is really bold enough, then his water the element is good. It's not. So now I will not be putting this in the such a long answer. I will not be putting it in the WhatsApp. So, okay, and then I found somebody, some people putting some other matter in our group. Please refrain from putting this because not as a social this thing group. So this is specific to our subject. Okay, please post only such things that can be useful for the student for our for our group. Okay, now we go to the channels. So we are going to deal with liver channel. Okay. Hello, are you able to hear me?
Yes, doctor.
Yeah, now you see that this one is coming. The flow.
Yes.
Are you able to see the flow?
Yes, sir.
Yeah. So this is how the liver channel travels. Okay. Goes like that. It ends there. This you can go on watching. See, it starts at the outer
Okay.
nail base, okay, of the
Picture
Inner nail bed, isn't it?
which is outside.
outside.
Inside is then the thighs, that is in between the facing towards the other leg, that is inside. So when it is facing towards the little finger, little toe, it is outside. So it is,
Okay.
it is on the outside nail base. Which starts from inside nail base. Which one starts? The spleen. Spleen channel starts SP1. Here this is liver 1. Starts. Yeah. And if you really see on the right side, no? On your right side, it ends at the liver. It ends at the liver. Okay. Anyway, you can play it again and again. You can see this. Okay. So this also will be so that it goes because where all it goes. See where all it goes. Now all these points. You know, if you have any problem in all these places, you see people will be having off muscle pain, and then this one, you see groin pain. It goes through the groin. You see that the groin pain. So, and then people having this is the rib. This rib is rib. What I am showing you, this is the 11th rib. Okay, the end, hip end, that will pain. All these things, problems of the in the liver channel, Okay, so the liver has how many points? 14 points. But here it says outer nail base of the big toe. Yeah, correct. This is what I said. No, outer nail base. Okay, outer nail base of the toe runs along the inner front of the ankle. Okay, inner leg and knee, ascending along the inner thigh, it reaches the stomach region and takes a turn, goes up to the 11th rib. I told you, 11th rib, wait, the 12th rib is the hanging. So it won't touch it. 11th rib, tip, that also hanging. So there it will pain. From here it takes a turn and ends on the nipple line in the middle of 6th and 7th rib. Okay. Understood? You understood this one, 6th and 7th rib. So what are the elemental points? Liver 1 is wood, 2 is fire, 3 is earth, 4 is liver, very important point, and liver 8 water. Okay. Liver 8 water. So what is the function of the liver? It is a detoxifier. Repair. All wherever there's an infection, repair, something has to done, everything, liver is involved. So this liver channel is even toxin removal. See, even a toxic bite, even a snake bite, give liver 4 point. You will get. Liver 4 is a very, very important point. So anything to do with your repair, pain, all liver. So wood is both gallbladder and liver. Gallbladder is the yang, liver is the yin. Okay. You understood the flow, right? And go the left points. First one is liver point, liver 1. On the lateral side of the end of the great big toe. 0.1 joule from the corner of the nail. 0.1 joule. It is wood on wood. Okay. What is it? It is centripetal coming in. Okay. Wood on wood. It is a horary point.
Yep.
So generally, any pain or anything, you can give liver 1 or any pain. any pain. Pain is associated with wood. The liver 1 you give for any kind of a pain.
Any place.
This pain is wood. This is a horary point. So you are energizing the wood. So
Any one of 14 point. Any one of 14.
liver 1. Liver 1 point you have to give, put a pepper and then tie it round. So you get a quick relief. Especially people having migraine headache. So migraine. So for them, this point works beautifully. Even GB also will work. This GB is better, but liver 1 also will work beautifully. Any headache, you can just probably once I told you the types of headaches. You give that point along with liver 1. Liver 1 is very good. It energizes the. Okay. Then this liver 2, it is a fire point. Fire point on the wood channel. So whenever the fire has to be energized, the fire is weak, the wood is good. So you start giving this liver 2 point. Okay. See, for example, somebody has got a problem in the heart. The heart is what? It is heart. Heart is fire. So
Yeah.
the fire has to be energized or normalized or balanced. So you can give from wood to fire. So on the wood channel, you give to fire. Heart is weak. Whenever there is a heart problem or anything like that. Okay. So you can give this whenever you want to balance between wood and fire. You can have this. You can use this part. Okay. And liver, where it is located at the base of the big toe. It is located at the base of the big toe. So you see here, it is on the web. In the base of the thing, it is on the outer side. The web, outer side of the big toe. Okay. So this is liver 2. So whenever you have to energize fire, you can give this. Even people having numbness in the foot. The numbness is can be due to 2 reasons. One can be due to nerve problem. Okay. And the other one can be due to the blood flow, the blood circulation, which takes place of blood circulation. It is fire. So at that time, you can give this liver 2 can give relief for numbness in the foot, especially diabetic patients. They have this mainly because the capillaries, they get blocked. So the numbness also will start. So even for the capillary block and the blood flow, so this will help. The blood flow, the blood flow is fire. And it is blocked. So there is a problem. That is why that is the wood. Wood has to repair it. So this point, liver 2, will help. Liver 3. It is bone joint of the first and second toes. It is the metatarsal bone. See, this is here. It comes like this. In this place, if you, for most of us, you just press that point, it will pain. It will pain. Most of us, even if you take the Burma massager, the first thing what they do is they cleanse this. This balances your earth and wood. Because most of the problem it starts from earth. And the wood also helps, that is the bile. It also helps in the digestion of fat. And if it doesn't, especially people who have ulcers, so you have stomach ulcers. you can give this one. This is liver 3. Liver 3. So for normalizing general health also, if your liver and your stomach are good, most of the problems can be also given as a general uh, health administrative. Anything to do with liver and stomach. Liver 3, very important. Okay. Sleeping disorder. You ask me whether liver 3 can be given for sleeping disorder. No, generally they are not for sleeping disorder. Sleeping disorder, best point is heart challenge. Okay. Now,
Dr. Raghavan, those who have got amputation done due to diabetes,
yeah,
to help in healing
amputation done
due to
because
diabetes,
because amputation is done because the blood flow, the capillaries get blocked only at the distal layer. So the blood flow is not there. So the then the whole thing becomes dead. The infection starts. So septicemia will come in. That is why amputation is being done. So in those places, give liver 2.
liver to the
Liver 2. Because the blood circulation will be good. Because only due to lack of circulation, the tips, the terminals, they get decayed. So whereas once the circulation starts, then they will become.
Because the healing is important. Some don't heal well after amputation also.
For amputation, again, because it's the same problem.
So you give on the good leg.
Give liver to, but you can give, suppose if one leg is amputated, give it on the other leg.
Other leg. Okay.
Other leg. Use the other leg. Right. The next one is liver 4. So what it is, how you can find out that is, see, when you lift this toe, so this tendon, okay, this tendon, it will also lift up. Just at the base of this toe. Yeah, this is the ankle, just at the base of the toe. That is liver 4. Liver 4 is connecting air and wood. Air and wood. So, whatever, toxins, because air is also a detoxifier, lung is also a detoxifier, liver is also a detoxifier, or anything to do with detoxification. Suppose let us say poison bite. The poison, what is a poison? Poison is only a protein, right? It travels in the bloodstream and then it blocks the artery. So the death happens. So here it will dissolve the protein so that the blockage will not be there. The blockage will not be there. So that is why liver 4. Liver 4 is very, very important for any detoxification or air. Air is only controlling wood, right? Air is only controlling wood. So once the air becomes all right, with the liver, then most of the toxins and most of the function of the liver get enhanced. Function of the liver gets enhanced. So liver 4 is too good a point. Use it. You can blindly use this point in some cases where you are not able to really reason what is what. So then you can give liver. Or any problem with liver. How will it show? It will show in the eye. Eye problem. Then nerve problems. Okay. Then tendon problems. All these things. Liver 4. Very good repairing. Then this is liver 8. It is slightly difficult to identify. This is water, liver and water, the wood and water. slightly difficult to identify. How do you do is, just like how it is done here. See, you just bend your knee and you will see the crease coming here. Just put one tune above. One tune. See, this is the crease. It will be here. One tune. Okay. This is the liver 8 point water. What is the equivalent point we have in kidney for this? What is this? This is water and liver. Okay. So what is liver and water? It is wood and water.
K1.
K1. So K1 is the one which is an equivalent point. So K1, as I told you, it is a very important point. Likewise, liver 8, which represents K1, but it is not as good as K1. Not as good as K1, because you cannot think that, say that, instead of giving K1, can I give liver 8? No. K1 is life force sustained in water. Whereas in here, it is this point which have see people, most of them will be having some pain in the thighs.
Nice.
Pain in the thighs. So that point, that place, the thigh, your buttocks, all these things, it is a water energy. Water, because thighs are bigger. That means it is water energy imbalance. So, especially for that thigh pain, this one, pump pain, all these things, you can use liver 8. Liver 8 or the,
No, I think chicken is for you.
okay. Right? So, this is water and food. Right? So, otherwise, see, as I told you, the groin pain. Yes. Sorry, there is a lot of disturbance. Not able to concentrate. So what I was telling? So the liver, as I told you, this is a detoxification, and especially for any pain. As I told you, whatever. So suppose you have a dull pain. So dull pain. So what point will you administer?
What? Tongue.
Dull is what? Pepper. So liver 3.
Huh?
Liver 3.
Liver 3?
Yeah, liver 3 is yet no. Suppose you have a pounding pain. What will you?
Pounding?
Pounding pain. Headache. Pounding headache.
Live 2.
Liver 2. Likewise. Heavy pain. Liver 8.
Yes.
Yeah, if you really see the thigh pain and other places, it will be a bit heavy. You always feel that it will be heavy.
All headache, liver.
Yeah, we can give this. Can you
All headache.
For all headaches.
admission liver 1 also. Okay, but we will come to GB channel. So GB channel also you will have this. Especially head means mainly GB. I will tell you why. Okay. And what else you can say about it? That's all. Something comes to my mind, I will tell you. A bit disturbed today. Now we go to the gallbladder channel.